Good morning, and welcome to our continuing series on homeopathy with Dr. Pachegaonkar. Namaste. Today we see more and more knee replacements. A friend of mine has had 4 of them. Knee replacements, a shoulder, and what is it coming to? And how can it be how can it be treated by homeopathy?
Actually, conservatively, it can be treated. Mainly in replacement, if it is like partial or complete, where weight bearing surfaces are given some reinforcement. So they add extra metallic plastic surface, they add to it through orthoscopy, and that provides extra grit to the weight bearing surface, so that further degeneration is not there and the whole brunt of weight it takes. So there will be no further erosion. But there are so many complications of these replacement surgeries, especially the knee joint, because it's mainly the weight bearing joint.
Yeah.
So there are known complications, and the commonest complication is deep vein thrombosis. Around 20% cases get deep vein thrombosis in knee replacement.
My friend has had to replace them twice. One of them, yes.
So it should be avoided. It should be the last choice.
I see.
Otherwise, it can be what we call rehabilitation of the joint is possible conservatively. So we have to understand that it is not on the bones there is a direct friction. We always walk, or all the movements are basically taken up by the muscles, tendons and the ligaments. And when muscles and tendons and ligaments, they are weak, placid, and they are not able to hold things in a right position,
In the bone.
then the erosion occurs on the cartilages. So there is a bone loss or a cartilage loss. So that is being compensated by surgical means. But what we can do is we can just strengthen the muscles and ligaments around it. Then sometimes the tendons or the ligaments are rigid, they lose elasticity. So that also, if it is recovered, then you don't need to replace the joint. Knee replacement or joint replacement is not warranted.
So you say that should be a last resort.
That should be the last resort, because again, see, if conservatively we treat, there is no risk. Sometimes the orthopedicians say that at this stage the replacement would be easier, because if there is a further loss, then maybe even the replacement may not be possible. This is the only fear they inculcate in mind of the patient. But mainly if osteoarthritis, if it is detected, and that time if you start correcting, in every case it is possible. And then there are no complications and patient's involvement is there. So in general also it helps. And conservative treatment means what? It is simple. Initially what we do is, if there is already a lot of degenerative change occurred, we ask the person to give partly a rest to that organ for a while. Suppose like one knee is affected, so we ask the person to walk with knee braces or with a strong knee cap, or sometimes we ask the person to walk slowly. We train the person to attain a gait where there is no wear and tear easily while walking.
Okay.
So it's like a partial, for example, if someone is getting down from a step, or one is crossing the threshold, so we ask the person to take support of reeling or someone to cross it. So that way, if it is just a partial rest also given, maybe around 2-3 months it may take, but person will recover. But
keeping the stress off that particular
Yes.
area.
Yes.
And in 2 or 3 months, they will recover. What do you do to help them recover?
So we give, of course, the constitutional homeopathic remedies we give, which help in recovering the elasticity, the tone of the muscles and ligaments. Plus, we train the person to be more aware while walking, because the very awareness while walking gives tone.
Oh.
So we train that way, and it helps. So we ask the person, we allow walking as much as the person wants, but that walking should be slower. Just like 20% slow gait walk would be enough. So that type of management we suggest to the patients. And we have done it even at the age of one person is 83. He is a ashram connected person, and because he had undergone bypass surgery for his heart, and recently his son passed away with heart ailment. So he was a bit depressed, and he told, I'm not going to go for knee replacement. I'll treat it conservatively. And then he approached us. Then we counseled him for gait and walk, and he did follow. And now he is 87, 88. He is walking about well. He goes for morning walk.
Oh my God.
So that time the orthopedician told, see, now also it is a bare minimum chance that we can do the replacement. But after few years, if you come, we won't be able to do it. But now it is not needed. He is walking about.
Are they correct in saying that, or is that a way to
No,
encourage?
this is arbitrarily. What happens, they have experience. Mainly what happens, the people who are taking painkillers, especially if there is a pain itself puts the patient at guard. So we don't need to ask the person to walk slowly, because there is a pain, person walks slowly. But now what is happening, because easily available painkillers, they get relieved from pain, and they walk very swiftly, nicely, as if they are cured. But there would be wear and tear of the joint accelerated by this. So they become more vulnerable when they are taking painkillers. But the people who are not taking painkillers, they themselves recover. If they don't take painkillers, they walk slowly, even without medication, they can improve. Because of pain, they are put at guard because of pain, and they walk slowly, and that helps. And actually, this is what we learned, that one person used to get pain in left knee for a few months, and that used to recover, and he used to get pain in the right knee. The orthopedician himself explained that when your left one joint is under pain, the other joint takes the brunt, and therefore that goes in wear and tear, and therefore that one starts paining where this has recovered. So that means definitely body has some means to recognize it and follow it. But homeopathic medicine, when we give constitutionally the medicines, they help in having better awareness while walking. At the same time, what we call mineral, of course, the vitamin D3 also. The other thing we monitor is vitamin D3. If the person has deficiency of D3, we suggest them to go for sun bath, so that the natural vitamin D3 is synthesized in the system by exposing skin to ultraviolet B rays. And that also helps in calcium metabolism. And the person gets very good tone in muscles and ligaments. That in turn helps.
Does homeopathy actually rebuild muscle or ligaments, or?
Yes, especially even we have seen even cartilage loss is taken care of. Like what happens, there is regeneration there. Only thing is that maintaining cause has to go. Means if the person is having constant erosion of that cartilage because of the muscle placidity, then it cannot recover. But once the person attains a good tone in the ligaments, especially knee joint, depending upon the rigidity or insufficiency or inefficiency of the ligament, we allow the person to take exercises. Then we give local massage with again homeopathic remedies. Plus internally we give constitutional treatment where the rigidity of the ligaments is recovered, they get wonderful tone, and in turn the cartilage also recovers.
In terms of time and seriousness of the incident, how long does it take for them to recover?
On an average, we suggest that it would take 3 to 4 months management, which is not a long, it's not an emergency. But the recovery starts within a month. The recovery starts within a month. It makes difference. So typically what we do is when we get a case with osteoarthritis and where like they have advised knee replacement, because people nowadays they are aware of potential of homeopathic system, but for a trivial pain they find it easier to take painkillers and manage. But once they are told to go for knee replacement, then they definitely approach us once. And there what we do is we counsel them for a proper gait. Then we give, we have remedies like Rustox and Arnica for local massage. And internally the constitutional remedy would definitely vary in each person according to individual symptomatology. So with these three aspects, when we treat, the person gets relief from pain within a month. Within a month.
So slow walking, attention to the
Awareness
particular
while walking.
area. Yes.
Because slow walking in turn helps in being aware also.
Yes.
If the person is aware complete of his movements while walking, definitely the tone is maintained.
So then we have massage and homeopathic remedy.
And physiotherapy to strengthen. So what we do is we just train them to have proper exercise specific to that joint. While sitting, while lying down, and while standing up later. First 1 month we ask them to take rest and very little physiotherapy indirectly around knee joint. And next month we start with vigorous physiotherapy, and after 3 months person doesn't need the treatment because it's local ailment.
How easy is it for them to get a knee replacement? Is it?
See, knee replacement technology is well developed, orthoscopic surgery is there, it is that way simple. Only problem is the complications. Recently I am treating one complication. One lady at the age of 80, unfortunately she did not listen to our advice. I had suggested that you take conservative treatment, medical homeopathic treatment. Maybe it would take 3 to 4 months. Then she realized that one neighbor, within 15 days she came walking after knee replacement. So she told her sons that you are not going for replacement just to save the money. And therefore the sons, okay, they said, and they got her operated. Both the knees were replaced within a month. And she was fine, and after 2 weeks she developed a complication. This secondary infection she developed. And then after 15 days the abscess came up and a lot of pus was discharged, and they started treating her. For 1 month daily they were dressing. She was hospitalized for that infection and they couldn't help. And then they told, now we have to fix the joint, means there would be no movement in that joint. That moment she realized that why not try homeopathy at this stage. And then she approached me, and now that infection without antibiotics, without any local management, because actually it was a chronic sinus which was formed, because already she was under treatment for the secondary infection for 4 months, and then she came, and that sinus got drained for 1.5 months, and without antibiotics, without any local management, with only internal homeopathic remedies, she recovered and she walks about. When orthopedician who had operated her came to know, and he had advised that now we have to fix the joint because your body has rejected the replacement.
Is that
metallic.
That's how it?
Yes,
How the
in
infection
rare.
started? Ah,
He came to see her and he was wondering that without antibiotics and all, how could homeopathy take care of it? But mainly it is, own system which develops that potential to overcome the disorder. And that sinus, secondary infection, everything got healed, and now she's walking about. She's 84, 85 now.
so is an infection a current problem with replacement?
They say it is 2% cases get
2%,
infection. But then deep vein thrombosis, sometimes what happens, there occur fractures in the surrounding bones because of this knee replacement.
I see. And what about rejection of the replacement?
That also
Is
in
that
few
more
people.
prevalent? Not so much.
Not so much. Not so much.
So you would counsel people to take homeopathic treatment
Homeopathic
and
treatment,
exercise properly.
physiotherapy, and proper rest and management. All the three things together means initial rest, and if one is not taking painkiller, things go easier. That is what we suggest, not to take painkillers if they have osteoarthritis or a joint pain, especially in weight bearing joints.
Even when the pain is very severe.
Even then, it would restrict the movement. See, osteoarthritis pain can be in any joint. Elsewhere it is fine, they are not vulnerable. Suppose it is in hand, one can give rest. But the knee joint is such that when some person has to be mobile, and there the whole weight would be taken up by one knee at a time.
Yes.
When one is lifting and walking. So it's a most vulnerable joint. Ankle and knee and hip, we can't give rest.
Interesting. Very
So
interesting.
when we sometimes we allow painkillers for short duration, say 6 hours, 7 hours, 8 hours during bedtime. So at least night
So they get
person will
rest,
not be
yeah.
vulnerable and they get perfect rest. But daytime, even if they have pain, they should bear with it. Or they should be bedridden with painkiller then. They should not walk about.
I see. Very, very interesting. Thank you so much, sir. Thank you.